Hi, this is Andrea with our podcast Expect More, and I'm so excited to have my guest, Monica McKitterick from Impact Family Wellness out there in Texas. I'm not even going to try my Texas accent. Welcome.
Thanks so much. And I'm not from Texas, so I don't have a Texas accent. But if you
Uh,
just throw a y'all in there, then everybody will think you're Texan.
Welcome to Expect More with Dr. Andrea, the podcast where we cut through the noise and get real about healthcare, physical therapy, and what it means to truly take charge of your health in today's ever-changing world. I'm Dr. Andrea Davis, physical therapist, straight shooter, and your go-to for no-fluff conversations that challenge the status quo. From the front lines of patient care to the big picture changes in the system, we're diving into what's working, what's not, and how you can expect more for yourself, your care, and your life. Real talk, real solutions, no settling. Let's get into it. So, Monica, please tell everybody who you are, what you do, and why we should care, because I care.
You absolutely should care.
Absolutely.
So my name's Monica. I'm a family nurse practitioner for the last 16 years. Wow, that makes me age. But I own a direct primary care office in the Central Texas near Austin area. And we've been taking care of people now for almost 6 years at Impact Family Wellness. And yeah, we are a membership-based primary care office that, makes healthcare not suck.
Yeah, healthcare does suck. Love it.
That does.
Love it.
Mm-hmm.
So how did you end up here, essentially? Like,
Oh.
not here on the show, but how did you end up here with Impact Family Wellness? Lay it out there.
Sure. That's a great story. So as I said, I've been an NP for 16 years. And after 10 years, I was about to relocate to Texas and trying to figure out what I wanted to do with the rest of my life. I was 35 and I had done orthopedics and primary care and urgent care and all sorts of different things. But I'd always had a love for primary care because I was trained to take care of a whole person. But primary care is so hard. It's 35 patients a day, treating your patients like cattle, just overwhelm all the time. And I couldn't do it forever. So I had been talking to my family and my friends, and, my phone listened to me and sent me a Facebook ad. And the Facebook ad said, primary care physician takes home $400,000 a year and is home in time for dinner. And I was like, well, that's a lie. Click. And I clicked on it. Right. I was like, that's not real life.
That's not real. No way.
No. And so I looked into it, and it was all about direct primary care, this new model of healthcare that was basically a gym membership for your doctor. And so I dove into it, did a bunch of research, and I went to my husband, who has an MBA. And I said, husband, I am going to open a practice where I can see less patients, take better care of them, have more control of my time, and make the same amount of money.
Yeah.
He laughed in my face, Andrea, literally just like laughed at me. And he's like, Monica, that's not real life. I was like, oh, but it is. So I did, right? I did more research and Googled how to write a business plan because, ChatGPT wouldn't write it for me back then. And I wrote a business plan. And I was like, all right, husband, I need $20,000. I'm going to open this practice. And by the way, I'm not going to get a paycheck for at least 6 months. And I'm going to move to a new town and do it there, by the way. New state. And he was like,
You like a challenge, don't you?
okay, let's do this. I'm not joking you. A year before this, I met a girl playing tennis and she had just graduated from college. And I said, oh, what'd you get your degree? And she said, entrepreneurial studies. And I said, what does that mean? I didn't even know what an entrepreneur was a year before I opened my own practice. So I did. I jumped in with 2 feet. I opened my own practice. We moved to Texas in March of 2019. And 3 weeks later, I opened my practice. And I had convinced 23 people that I knew what I was doing.
Yeah. And how many more since then, for sure.
Right.
Yeah.
So, 6 years later, here we are. We have 3 locations. I have 7 nurse practitioners that work for me, and we have over 2,000 members now. So yeah, it's been quite the journey. But yeah, it's been a struggle. As any business owner knows, there's highs and lows, there's mistakes, there's never failures because I learned from them all. So they're all mistakes. But yeah, it's been a journey in the last 6 years.
And this right here, the way you speak, just direct, straight to the point. This is why I love you. And I think this is why we hit it off when we met in a random place that we went to, bizarrely. Uh, so we met, I'm just going to say, we met filming a TV show, basically a competition show called The Blocks, where you flew to an undisclosed casino area with very little information and basically dove into the entrepreneurial world. And
Yeah, it
I
was great.
totally thought I was going to be the only healthcare provider there. I went in all like, yeah, I got this, whatevs. And then I met you and I was like, whoa, hold on a second. There's another one? No way.
Right. And we met in the bathroom during a break
You did.
in a pod session. Yeah, that experience was insane. And so great. And I loved it. And if you're watching this before, let's call it May of 2025, then the show's out because we're hopeful it's coming out. But season 18 of The Blocks, Amazon Prime, little plug there. Just go watch it and you'll watch these two ladies. That's right. The two of us rock it on that stage.
Totally.
Spoiler alert, we made it on the stage.
We
Just saying.
did. I know. How many times is the question?
We'll just have to watch and
I
figure
know.
it out.
No, it's amazing. So, like when we met, we definitely shared a bond very quickly over the struggles in healthcare and the fact that it's not easy. Number one, taking care of people is not easy, and then trying to marry the business of healthcare with the care of healthcare is next to impossible, really. So then, I mean, we're a hybrid practice at Davis PT, which means we accept both insurance and cash. But my mind was blown when you were like, "Psh, insurance sucks. I'm not doing that game. No way. And I'm successful and I have profit margins and people love me. And wait for it, 3 locations, not just one." I was like, tell me more, Monica. So please explain to us what direct primary care actually is, and how you've been able to finesse this system.
Sure. So as I mentioned, direct primary care is much like a gym membership for your doctor. So all of our patients pay a monthly fee, and then they can come in as many times as they want. There's no office visit fees. There's no copay. It includes their annual physical, telehealth visits, direct access to their provider, same day appointments, online scheduling, cheap labs that I'll actually tell you the price of. We have a free consulting service for specialists for our patients. And bottom line is we're just advocates for them, which is really what you need in healthcare. But unfortunately, the insurance-based world doesn't have that capacity. So the big difference between us and your insurance-based practice is the number of patients we take. So in the insurance-based world, an average primary care provider is responsible for 2,500 patients. And so you wonder why you can't get an appointment with them. Well, it's because they have all of these patients. And you wonder why they can't spend more than 2 minutes with you. It's like, well, because the insurance company is dictating what they do. You walk into an insurance-based practice, you're not the customer. Your insurance company is. And unfortunately, as a healthcare provider, I have to do what your insurance company says, not what's best for you. And those two things rarely are in line with one another, right? Because I'm a healthcare provider who wants to take care of you. Your insurance company, let's just be honest, they are a for-profit company and they are all about their profit. And so it's just a different way of healthcare. So, one of the biggest things we get is, well, what do you mean you don't take my insurance? That means you're going to be really expensive. It's like, no, your membership is $75 a month, right? So for less than $1,200 a year, I mean, less than 11, I guess, you can get unlimited care and a person who actually knows your name and isn't dictated by the world of insurance. So I can, take care of you like we want to, right? As patient and provider want to, not what insurance company says.
So collaboration, right? So it's 100% a collaboration, which I love.
Absolutely. It allows us to be more holistic. Unfortunately, the insurance-based world might incentivize providers to write prescriptions, which, don't get me wrong, there's a time and a place for drugs, but we way overuse them in this country. When was the last time your primary care provider talked to you about your stress, your sleep, your nutrition, or your body movement?
Girl.
If those 4 things have not been spoken to you in your annual physical or your visit with your provider, you're in the wrong place, because I'm here to tell you they're just putting Band-Aids all over things. And the fact that we as ladies, any woman out there who's over 40, I promise you're going through perimenopause and it doesn't have to suck. But unfortunately, we have
not all the time anyway. Not all the time. Yes.
Right.
Yeah.
There's ways to make it better. But we have to have those conversations. And when you only have 7 minutes with your patient, you have no time for that. I will tell you, I was really good at being a PCP in the insurance-based world. And it's because I'm good at cutting people off. I'm good at telling them like, oh, I don't have time for that story. I need to move to the next patient. Let me see what Band-Aid I can give you. And I was real good at typing while pretending to listen. Yeah, I hear you. No, I didn't hear a thing you said. And the worst part about it was I would see a patient. I legit wanted to care for them. Like, that's why I went to school forever, right? It's to take care of people.
Yeah.
And then I would try to fix them the best I could and tell them, hey, give me a call if something's not right. Well, they would call me, but I'm like the Wizard of Oz at this office. It's like I'm in the back and no one can get to me. And that's because I'm the only person making revenue, right? I'm sure you see this in your practice. The people that bring revenue into your practice are the physical therapists themselves. Your receptionist isn't bringing you money. Your office manager not bringing you money. If you're not seeing patients, Andrea, you're not bringing yourself any money, right? And so these people are so focused on getting through those patients that they don't have time to actually take care of people. And it's sad and it's awful. And this is why we see so much provider burnout, is because most healthcare providers spend more than 70% of their day doing paperwork for an insurance company.
It's the one big thing, huge, massive thing that shocked me. Went to a PTA meeting last year, whatever, one of the national conferences, and they were commenting on 2 years out of school. 2 new PTs, 2 years out of school, they're leaving. They're out of the profession. They're gone. And it's because, they're seeing 4 an hour. They're seeing, and it's insane. And if you're new, I've been talking about this recently. If you're new to medicine, right? So you go to all the schooling. Yes, I have checked all the boxes, all the things, but you haven't really experienced medicine enough. You need some time to be able to see a knee for us, PT, see a knee. You see the same symptoms, this patient, maybe another patient next week, and then you start to pick up on these things. But that takes time. I mean, I've been doing PT 25 years now. I'm full out, like yourself, out of clinical care, but I'm still teaching. And that's one of the things. It's you can't create efficiencies if you don't really learn in real time. And then if you're getting burnt out by year 2, there's no learning curve, and you think that's all there is. So there has to be a better way. And that's one of the things that you and I, we have different fields, but we are direct care providers as well. And my practice is as independent as you can possibly be. We have we have strong referral sources, but it's usually word of mouth or people in town. They call me. I did a video evaluation last night, sitting at the bar with my husband having dinner. Someone called me and I was like, just put them on FaceTime, do this, try this. Okay, it's this, do this. And they just want to know somebody cares. So I so love what you're doing in that model. And it seems to be it's working well for you, clearly.
Yeah, absolutely. And the model of direct primary care isn't something I came up with. I wish I could take that credit. But it's been around for about 15 years and it's slowly gaining traction. And I think that's only going to continue because people are finally putting their foot down. I mean, you know what? This is awful. I mean, it blows my mind where insurance companies get to dictate where you go for your healthcare. This is the beauty of the direct care world, is that our patients show up because they want to see us, not because someone told them that they have to see us.
Right.
And so that's a big difference. And I will tell you, once the rest of the world becomes direct care, everyone will get better care. Because I don't know any healthcare provider that goes into healthcare to be an asshole. Sorry, was I allowed to say that word on this?
You are now. We're good.
I mean, most healthcare providers are very genuinely kind people that want to take care of others. Yes. But then they get into this system where they can't do any of that. And they just get in this gross rut where all they hear is complaining all day long from patients and staff, and it's awful. And they wonder why they run the other way.
Yeah. Well, and then if you're middleman, right? So if you're not in management and you're in healthcare and you're the middleman, you're the provider, right? Like you said, you have to provide the billable services to support the administrative above and take care of the patients below. So now the administrators are now telling you, oh, we're going to score you, right? We're going to give you, I've watched this be implemented in the hospital systems. We're going to give patient satisfaction scoring based on how your care is perceived, not if you're doing the right thing by the patient. Right? It's insane. So then if you're being pressured to keep your numbers up, keep your revenue up, keep your, scores up, it's almost impossible to do.
Well, then you start doing things for patients because that's what they want, not what not because that's what's good for them. And you don't have the time to explain to them, like, listen, I know you walked in here and you think that this is the best for you, but my 16 years of experience says maybe we should consider something else. But I want to make sure that you give me a 5-star review. So you know what? I'm just going to do exactly what you want. It's not great for the patient, but it's what happens. And I'm going to tell you, Andrea, I think one of the things that sets you and I apart from every other CEO of a healthcare place is that you and I have done every single job in our clinic. I have cleaned the toilets. I have done the fax inbox. I have called the pharmacy. I have cleaned up vomit, right? I've done all of the jobs where these CEOs of insurance companies and big hospitals, they have no idea what the provider actually does. They're just looking, right? They're just in it for a business. And so they don't understand when they're like, oh, healthcare provider, you have to see 30 patients a day. They don't understand. They don't get it.
Well, and that was my biggest fear, Monica, to be honest, like coming out of patient care, because I'm like, oh, I have a team of 8 clinicians. Oh, I don't want to be seen as like the woman upstairs in the box that's just calling all the shots. So it's distasteful in the sense that if you don't know what I do and how I do it, Antoinette, my number one and I, we have the saying where I'm looking up and out and she's looking down and in, essentially, because I'm trying to think outside the box to, like yourself, to kind of keep things moving in the right direction, patient-centered. And she's telling me if we're on point or not. Like, is this doable? I'm like, oh, let's try this. Is this doable? And she's like, oh, that's really asking a lot for these guys. I don't really think it's going to move the needle a whole lot. So, maybe we think it over. But it's definitely one of those things that I think healthcare in general, I think we're going to go through some sort of a mini revolution. I am highly invested in the new, the younger demographic that's coming out, wide-eyed and hopeful, and I'm going to be an amazing practitioner. And I want them to see that there's options when they feel like they're getting smacked in the face with, this is the way it is, kiddo. This is the way it is. Either get on board or get out of the way. No, you don't have to get on board with that. You can do something else. So, and that you're definitely proving that, which is like so awesome.
Yeah, well, I mean, it's amazing what happens when you treat your employees like human beings and not just money producers or not money producers. I met with a CEO of a local healthcare place the other day, and he was like, yeah, I work my people hard, and they have to make sure that they refer to at least 6 of our ancillary services every week. Otherwise, they get docked. And it's like, I'm sorry, if I don't see enough patients for your ancillary services, what? And I mean, this is how primary care works. This is why all the big hospitals are buying up primary care. Primary care doesn't make money at all in this country. It's the referrals that do, right? Yeah. It's the referral to the surgeon. It's the referral to the cardiologist. That's where they can actually make money. The same holds true for an emergency room. Emergency rooms are a giant suck on the healthcare system. They do not make money. None of them do, but they refer patients to surgery. And that's where you can actually make money.
Do you think that in the grand scheme of like healthcare and where medicine is moving, so I've been doing this 25 years, so I lived in the paper world and transitioned into the EMR world. Like, do you think that there's been a significant increase on the stresses put specifically to primary care, not just medicine in general, but primary care, to the point where you used to be viewed as the quarterback, right, for all of care? I mean, that's what we used to centralize everything to talk to your primary care doctor, talk to your primary care doctor. It feels like that's not really, like, urgent cares came up, minute clinics came up, and I think they all have their place, but it feels like primary care in general has really, that medicine specifically has been eroded from what it originally was meant to do.
Yeah, 100%. And I think that's several fold. One, medicine gets more and more complex every year, right? There's more medications, there's more diagnoses. We know all this about new autoimmune disorders. And so as a primary care provider, you can't be the expert in it all. Mm-hmm. But also because primary care, the reimbursement for it continues to go down year over year. I mean, I know, right? Because, your milk is cheaper now than it was in 2000. Oh, no, that's right. It's not. Yet the same Medicare patient that I see today in 2025, I get paid $14 less than if I'd saw them in 2000.
2.5% every year.
every year, right? And people don't realize that. And so if you wonder why there's nobody taking Medicare, there's your answer.
Yeah,
No providers are going to take it. But not only is it, there's more diagnoses out there, but also the workload is higher. So not only has Medicare done this, but now we have all of these guidelines and rules and MIPS that we have to do, which no people outside of healthcare see, right? It's that question every time of their falls risk. Did you do a falls risk? The kid's 17. Like, no, not at risk for a fall, okay?
The administrative burden is insane.
It's insane.
Yep.
And so because that administrative burden has gone up, I feel that primary care has even less time to spend with them, right? Because now your 15-minute block is, do I have your BMI on file? Did we review your social history? Because that's really what's important, right? And so now primary care providers tend to refer out even more, right? Okay. It used to be, you're a newly diagnosed diabetic. We're going to start you on some lifestyle changes and some things. Not anymore. Now you get a diagnosis of diabetes, you're going directly to endocrinology, which is a waste of time and energy and resources because that PCP knows how to manage basic diabetes. Mm-hmm. They know how, but they don't have the time. They can't sit there for 20 minutes and explain to them the difference between the glycemic index.
As much as they want to, right?
Oh, because absolutely they want to.
They feel like they have to do that. They want to do that, do the right thing by the patient. So they're probably hoping the next one, hey, I want you to go see, Dr. So-and-so because he's going to break it down for you.
Right.
Because
at least they're going to hope so.
Yeah.
But they're probably going to see the endocrinologist who's then going to send them to a diabetes education specialist who then might send them to a nutritionist. And all of this is costing money and time, right?
And so time? It's the patient's time and the patient's money.
Absolutely, because they probably have to pay a copay every single time.
Sure.
And so that was a struggle for me when I was in the insurance-based world is I would see a newly diagnosed person with high blood pressure. I really need to see them back once a week. Let's check this out. But they have to pay their $50 copay every time or their $135 because they have a high deductible plan. And so now in my life, in my direct primary care world, it's come in once a week. Let's do this, or let's at least have a telephone conversation. So it's just so broken for so many reasons. I recently did a video series on YouTube called "Have You Ever Wondered Why?" Healthcare Edition. You should go watch it. It's going to be published shortly. But it answers those questions of why can I only talk about two things at my...
And you have to pick. Right? So they have to pick, and it may not be the two things that the patient comes in wanting to know that are the highest on the triage list, essentially. Because I mean, my profession, me in particular, having been around for a while at this point, I definitely have felt in more recent years like what used to be considered a primary care physician. Now, I am not a physician in any way, shape, or form. I have doctor before my name only because I took an extra couple of years of schooling. But they trust what I have to say. And they're like, let's talk to Andrea and see what she says. Well, I think you should see your family doctor, or I think you should go see ortho, or I think just rest for a couple of days and see what happens. And that does more sometimes for people just knowing that you have their best interests at heart, right? You truly, they're paying a subscription fee, but you truly have their best interests at heart. And they feel that, they know that, and they want more of that. They want to know that Monica actually cares about me. And Monica said that I should do this, this, and this. And maybe I could cut off a couple of pounds if I just walk 10 more minutes a day, something like that. Yeah. It's incredible.
Andrea, speaking of, have you ever wondered Healthcare Edition? Why on God's green earth do I have to write an order to let you do your job as a physical therapist?
I don't know. But you can write all the orders you want for me. I will take them all.
I'll just give you a blank script with my signature on it. For those that may not know it, if you go to see a physical therapist, they have to have a referral from a provider, a healthcare provider with an NPI number. So a PA, an NP, or a physician within 10 days. Is that all across the country, or is that state specific, Andrea?
No, it's state specific. So actually in New Jersey, we're quite fortunate. We get 30 days. So you could walk in off the street and see myself or one of my teammates for 30 days. And if there is no significant progress, our timeline is 2 weeks. So if there's no significant progress in 2 weeks, we change the game plan, or we change the provider, or refer you back out, or whatever it is. But yeah, no, that's been going on for years and years and years. Every state has a different set of rules for physical therapy. The amount of school, Monica, the amount of school that we go through. I have 3 degrees. I have a bachelor's, master's, and doctorate, and I still, yes, have to defer. In musculoskeletal issues, we study anatomy inside out, upside down, all over the place. So the fact that we are held to this, like at arm's length, like, don't
Right.
tell us, we'll tell you. It's like, oh, that's
Right.
nice. That's what I do.
'Cause I don't have that training. I did work for an orthopedic surgeon for a while, so I probably have more than the average.
Yep.
But
Totally.
the fact that in Texas, it's 10 days.
Wow.
Half the time they're only seeing you once in 10 days. Like, you have to give it a chance. And so it really annoys me when patients can't get care. Because to be honest, like, if you're a patient of mine, sure, I can write that for you. But how many patients would call their primary and not even be able to get in for 10 days?
I'm case in point. I'm shopping around for a new primary care practice, really, because mine went. My nurse practitioner, who I love, she saved my life, actually. So huge NP fan. When I saw, case in point, 2012, I couldn't breathe. I was working, couldn't breathe, like, maybe allergies, October type weather in New Jersey gets a little weird. Went in, they gave me prednisone. So took that 10 days, whatever, still it was getting worse. Couldn't talk, couldn't breathe, whatever. I was working, coughing after seeing patients. It was awful. Go back again, see another doctor, up the dose of prednisone. Still no change. Go back again, see 3 doctors I saw until I finally saw a nurse practitioner, and she said, "Oh, sweetie, honey, no, you're actually having a reaction to the prednisone." She gave me an inhaler, cut the prednisone, gave me an inhaler. Literally 48 hours, I was back to normal. I refused to see anyone else within that practice because I was I was dying, literally felt like I was dying for 3 weeks, and nobody took the time except her. So if I'm experiencing that, and I'm fairly well educated in the medical world, and I still couldn't advocate well enough for myself, I can only imagine, general population, what they go through trying to figure things out.
No,
So
the struggle is real. I don't know how anybody gets through, especially raising children without like a provider in their back pocket.
no. So
Yeah.
I mean, you are a beast. I'm like so grateful, and we're gonna talk. We're gonna book another time, and we're gonna talk about perimenopause, because I want to pick your brain all day long about that. Please,
Let's do it.
family life and starting a business, especially as chicks. Like, I was told straight out of the gates, "Don't you want to spend more time with your children?" And I'm like, why can't I? Why do you assume that I can do both, right? Nobody would ever say that.
Maybe not. I'm just kidding. They're great. They're great. I love them. Don't.
No, not at
But
all.
yeah, no, it's being a female, a mom. There's a lot more struggles in the world. But yeah, it's I'm here for it, Andrea. I'll come back and chat with you anytime.
Yeah, man, we got to inspire the next generation and be strong for the ladies out there, both young and old, for sure. You're a beast. I love it. Tell us how we can find you, learn more about you, and get on your subscription plan, please.
Yeah, if you live in the state of Texas, we can take care of you. But, those state rules say that if you live over state lines, my medical care cannot be provided to you. I guess I get dumb when I cross state lines. I don't know.
I don't know.
But we are Impact Family Wellness on all the social platforms. ImpactFamilyWellness.com is our lovely website that'll give you all the information. If you don't live in Texas, but you still want to look into direct primary care, you can Google DPC, Direct Primary Care Mapper, and it'll pull up a map of all of the direct primary care offices across the whole country. Not all of them are as great as mine. I'm sorry, I can't vouch for them. But there are other providers across the country doing this, and it's we really need to turn it into a movement. So I really appreciate you having me here, Andrea, and for all that you do in the PT world and taking care of people.
Yeah, girl, back at you. And anybody interested, check us both out on season 18 of The Blocks, which will be airing on the website and Prime sometime soon. So have a great day, Monica, and I will see you soon.
Thanks, Andrea.
That's a wrap on this episode of Expect More with Dr. Andrea. I hope you're walking away with something real, something that challenges how you think about your health, your care, and what you deserve. If today's episode hit home, share it, leave a review, and make sure you're subscribed so you never miss the real talk. Because in a world that keeps shifting, one thing is constant. You should always expect more from your providers, your movement, and yourself. Until next time, keep showing up, keep asking questions, and never settle.